Hey everyone, so this presentation is about autism and it is by Catherine and Hannah. So the first thing is, what is autism spectrum disorder? Autism spectrum disorder is a disability that can cause social, communication, self-regulation, and behavior complications. People that have ASD tend to have trouble understanding what other people feel and why they think a certain way. In turn, this also makes it hard for them to express emotions to other people. Those who have ASD may have trouble learning at the same rate of their peers. Typically, ASD appears between the ages of 2 and 3. However, you may notice signs of ASD earlier than that. The earlier autism is caught, the more beneficial and rewarding it is later on in life. So, how common is ASD? ASD is more common in boys than it is in girls. 1 in every 27 boys are diagnosed with ASD, whereas 1 in every 116 girls are diagnosed with ASD. ASD is 4 times more common in boys than it is in girls, and 31% of children who are diagnosed with ASD have some sort of intellectual disability. So, what are the symptoms of ASD? If a child has autism, they have social interaction difficulty, such as avoiding eye contact. A child does not respond to his or her name by the age of 9 months. A child who does not show facial expressions by 9 months of age. Some examples would be smiling, frowning, or being surprised. They also have limited gesture cues by 12 months of age, such as waving hello or goodbye. They do not show interest in other people or toys. Another thing that is very common is that some people with autism will line up their toys or like other objects in a row, and then if something happens to that row or something is changed, it causes them to become very upset. One thing that is not as common but can be a symptom of ASD is epilepsy or seizure disorder. So, what is the treatment or cure for ASD? Currently, there isn't a cure for autism. However, there are things that one can do to help. So, there are certain medicines that can help with attention and behavior, physical and occupational therapy, seeing a speech or language pathologist. There's also animal assisted therapy and nutritional therapy.
What a teacher should know about teaching a child with autism. Children with autism perform physical activities well with their peers, and children with autism are not able to perform at the expected levels of their peers due to their communication and social interaction insufficiencies. However, children with autism are often hyper aware of sensory input, and it's helpful for the educator to provide accommodations so their students can focus in class. And these activities would involve sensory stimulation. And the majority of children with autism have motor impairment. And physical activity is beneficial for every individual, especially those with autism. So, a routine is crucial when teaching a child with autism. Giving short and concise directions is important as well. And it's also important for teachers to engage and play with their students. When you're teaching someone with autism, it is important to warn students about changes in the routine or changes in activities. For example, in 3 minutes, we'll put our games or equipment away, and this helps students with autism know what to expect. Teachers should also adjust the setting to minimize aggression and determine if triggers can be eliminated, triggers such as horns or buzzers. Some activities students with autism can do would be bowling with plastic pins and balls and auditory sensory play, so like musical chairs, white noise machines, Simon Says, and Photo cards are also important because students with autism have strong visual skills.